One of the things is you said when you started your training to be a psychiatrist, um, everyone else or a lot of people in the classes were a little afraid of the patients. What is something that you had that made you not afraid? Or like what was something, some information or willpower that made you kept going with it?
That's a good point. So when I was in medical school, which is when we're doing those rotations, is when people would kind of talk about being, afraid. And for me, I guess I have this internal belief that really mental health conditions really are like other conditions. And, people are really suffering. And so I guess part of it was two things. There was the data that, that really shows that people with mental illness aren't more dangerous than other people. So that's just what the facts show. So I feel like I have that info. And then I'm just really comfortable with people who are different, and if you get into the mental health field, you'll realize there's a lot of people in the field, therapists, psychologists, psychiatrists, who are also kind of quirky and kind of different. And I think they're drawn to it because they're different. And so the profession is very colorful. I'll say that. But I guess that's part of it too. Is like I actually, when people, let's say they talk to themselves, I'm like, okay, I don't think that that's necessarily something to be like frightened about just because people are, responding to internal stimuli that they might have or something like that. So I think it was those two things. One was just the data, the information that we were learning. And then two, just like I have a lot of tolerance for a lot of different kind of behavior. And maybe that's just like my personality type.
Okay, great, great, great.